There are 7 things that most of my patients are doing wrong. Hi, my name is Whitney and I'm a dental hygienist here to talk about 7 things dental hygienists wish you'd stop doing. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to join thousands who have already discovered all of the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. I made it just for you, for it can help you stay on routine and improve your dental health. Having said that, for today's video, let's talk about what you need to stop doing. Number 1, flossing with the seesaw motions. Not only are you not supposed to just pop the floss in and out, but you're absolutely not supposed to seesaw it. That's the insertion motion, but the actual cleaning motion is up and down. So sawing it between your teeth, the seesaw is only for getting the string in between your teeth. And then once it's there, then you're supposed to use the cleaning motion. This is where you hug the tooth with the floss. The floss is in like a C shape and you go up and down to the left and then up and down to the right, making sure you're really wrapping around each side of each tooth, cleaning the sides of all the teeth. Number 2, using an electric toothbrush like a manual toothbrush. I've seen so many patients who use electric toothbrushes wrong. They are using them like manual toothbrushes, which is incorrect. If you use an electric toothbrush, you have to just let it do the work for you. Angle it 45 degrees toward the gum line, so up toward the gums on the top teeth and down toward the gums on the bottom teeth, and just guide it along from tooth to tooth. You never want a scrub brush. Just let it do the work for you. Honestly, even with a regular manual toothbrush, you never want a scrub brush either. I will link my tutorial videos if you want to learn more about the different techniques between the 2 types of brushes. Number 3, not brushing your tongue, or even better, not using a tongue scraper. 90% of bad breath bacteria sit on your tongue. So not only is it important to brush your teeth every day, but it is also important to brush your tongue. And the best way to do that is by using a tongue scraper. Brushing it with a toothbrush is fine, but a tongue scraper is even better because there are so many little crevices on your tongue that bacteria can get caught in. And if you don't have a tongue scraper, no worries. You can actually use a spoon from your kitchen. It actually works pretty well. But if you want an actual tongue scraper, I will link some product suggestions in the description box below. Also, if you tend to get tonsil stones, make extra sure that you're using a tongue scraper and using it properly, for it can really help prevent those from forming by reducing the bacterial count in your mouth. Number 4, using mouthwash for no reason. Mouthwash in general isn't needed unless it's recommended by your dental provider. Sometimes for extra cavity prevention, if you're cavity prone, or sometimes for sensitivity relief, or if you just had gum surgery or you're struggling with gingivitis, there's different reasons to use different ones. But just to use it without a rhyme or reason, if no one ever told you to personally use a specific mouthwash, then don't. It's not important. What's important is brushing and flossing and cleaning between your teeth properly. Number 5, eating chips instead of candy. Wait, what? As a dental hygienist, I have found that most people are unaware that fermentable carbohydrates are more likely to cause cavities than candy. And so many foods that we commonly eat are fermentable carbohydrates, such as chips, bread, crackers, graham crackers, goldfish crackers, cereal, pasta noodles. Those are all considered fermentable carbohydrates and they are no good for teeth. Most of us know that sugar can lead to tooth decay and cavities, which is why lots of us try to avoid eating too much candy because of its association with sugar. And we might be looking at candy in front of us and think, I'll have the chips instead. Chips are better for my teeth than candy. But no! With these fermentable carbohydrates, the chips, bread, crackers, they specifically break down into sugars while they are still being chewed in your mouth. So they are sugars too. They are very sneaky sugars. And they make the mouth more acidic, which increases your chance of tooth decay. I will link my video that goes into more detail about how carbs are worse for your teeth than candy if you're interested in learning more about ways to prevent tooth decay if you tend to eat lots of carbs. Number 6, using your teeth for things other than eating. So biting your nails, chewing ice, using your teeth to open things. We don't want to do any of this. Of course, I'm sure you're aware that using your teeth for anything other than chewing food increases your risk of teeth chipping, breaking, and being damaged. Next time you think about opening a bottle or something with your teeth, think again. Stop. Don't do it. Teeth are very expensive to fix. Find a bottle opener. Open it the right way. And lastly, number 7 is not wearing a night guard. So I was at a CE course, a continuing education course recently, where I learned that about 90% of adults clench or grind their teeth. And stress can cause teeth grinding. And it seems as if most of us are stressed. At least 90% of us are stressed. And the bad thing about teeth grinding, other than, of course, it can hurt your jaw, but also it can lead to wear and tear of your teeth over time, causing chipping at the enamel and damage to your smile. If you're grinding grinding during the day, it's easier to fix because you can remind yourself to stop doing it. Just like if you slouch, you can be like, remind yourself, sit up. But at night, you can't just tell yourself to stop because you're asleep and you're doing it subconsciously. So wearing a night guard when you sleep will give your teeth a protective shield, preventing serious detrimental dental issues. I've had patients that literally grind their teeth down to short little teeth stubs, or they grind so much that they give themselves gum recession, or the worst is if their bite is off in addition to clenching and grinding. And if they are putting too much pressure on, say, one random tooth, now this one random tooth is so traumatized that it needs a root canal. I just had that the other day with a patient. So really consider getting a night guard if you suspect that you are clenching or grinding while you sleep. At least until you could find out the root cause, what is causing the grinding. At least protect your teeth. In all, staying on routine with proper brushing 2 times a day, using your electric toothbrush the right way, proper flossing technique at least 1 time each day, using a tongue scraper, all of the things we talked about. The most important thing is to stay on routine and never skip a day of brushing or flossing. And speaking of routine, if you're interested in creating the perfect oral care routine to prevent major dental issues and costly dental visits, be sure to click the link in the description below or in the pinned comment to sign up for my free oral care guide to discover all of the essentials for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile, and it could save you tons of money at the dentist by maintaining your teeth at home. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.